afternoon. My name is Cecily Weisberg, Managing Editor for Digital at the Keene Sentinel, and I'm joined by my colleague, Olivia Belanger, the Sentinel's health reporter. Today, we're welcoming two guests to answer your questions about the COVID-19 vaccine, Ryan Hornblower and Dr. Alok Kole of Cheshire Medical Center. Ms. Hornblower has master's degrees in management and public policy and is a nationally registered paramedic. She serves as Cheshire Medical's EMS and Emergency Management Coordinator and Vaccine Coordinator, leads its incident command, and manages its response to COVID-19 and other emergencies. Dr. Coley serves as the infectious diseases consultant and the physician lead for the hospital epidemiology, infection prevention, and antimicrobial stewardship programs. Welcome to you both. Thank you so much for being here.
Thanks so much for having us.
Yeah, thank you for having us.
So we've received a number of questions already, but please go ahead and ask your questions in the comments below on this post, and we'll try to get to as many as we can. So our most frequently asked question so far has been, when and how can I get the vaccine? So I'm going to turn that over to Ryan to give us some information on the process so far. Ryan, can you take it away for us and help us understand what's going on?
Sure. Thank you. First of all, thank you for having us. So this is the biggest question is, when can I get my vaccine? So if some of you have saw the governor's press conference yesterday, he talked about the rollout for the phase 1B vaccine, which will be available to any residents who are 65 or older, family, the medical vulnerable with significant conditions, 2 or more conditions, also caregivers of those medically vulnerable children of 16 and under that aren't currently eligible for the vaccine. Also residents and staff of residential facilities for intellectual and developmental disabilities, corrections officers and staff working in correctional facilities, and then first responders and healthcare workers not already vaccinated. So the information on the process is still pretty fluid, and Cheshire is working with our public health network, with our the state government to make sure that all people that want to be vaccinated are vaccinated. People that fall in these categories will be able to start scheduling on the 22nd through the vaccine.newhampshire.gov website, with vaccination starting on the 26th.
Great. So once people sign up, and again, that's vaccines.nh.gov, and this is anyone who's a New Hampshire resident who's age 65 and older can get a vaccine, and they can start signing up next Friday, January 22nd. That's all correct?
Yes.
Okay, great. So what's
yes.
Okay.
And the residents who have the 2 or more medical conditions will need to get a letter from their primary care stating that they're eligible. Those details are still being worked out, and we are asking residents in our area that are part of our DH system to wait for us to contact you with information on how to get signed up.
Okay.
And not call directly. Yeah.
Okay. So if you are 65 and older, and registration again is going to open next Friday, January 22nd, are you going to be notified before then, or can you just go ahead next Friday and go to the website and start signing up?
You can go to the website and start signing up through that website. When you go to that public site, which here in this area is on Criff Road, as part of our public health network, you will need to bring something to prove that you are 65 and older, driver's license, etc., when you go there.
Okay.
For
great.
a double check.
Great. So just be sure you have some identification when you do get an appointment. So when people go to register, can you tell us anything about how that process is going to go? Like, is it going to be complicated, like emails back and forth, phone calls? What do you know about how people are actually going to sign up?
I don't know all of those details yet. It's still pretty fluid as we're getting more information from the state, and there hopefully we'll have some more information today to be able to give out to the community.
And do you know what area sites are going to be open for people here in the Monadnock region? You mentioned Criff Road. Are there any other places where people are going to be able to go to get the vaccines?
So it will be through the public health networks. There's 13 public health networks in each region. So ours is at the Criff Road for the Monadnock area.
Okay. So do you know, is that going to encompass pretty much all of southwestern New Hampshire, like as far as Peterborough, or how far sort of would people be coming to Keene for their vaccine?
Yeah, we are working closely with Monadnock Community Hospital as well to incorporate everybody who wants to get a vaccine vaccinated.
And there are some people whose doctors may be in Vermont or Massachusetts, or who live in Massachusetts but come here to Cheshire Medical Center for their doctors. How is that going to work? Do you have to go to a place where you're a resident of, or can you go where your doctor is?
Yeah, you have to go where you're a resident of currently.
And another thing that we wanted to talk about was we're talking about going online and filling things out and potentially getting emails. What about people who aren't computer savvy, who might not have email, who don't really aren't really good with the computer? What can they do? How can they get their vaccine appointment scheduled?
Through the press conference yesterday, the governor had stated that people could call the 211 number to get assistance on how they would register further if they're having troubles with internet, being tech savvy.
Okay, so that's called 211 if you're going to need some help going through the process. Okay, great. One other thing that we wanted to talk about was for people who have two or more of these conditions, those people are going to be in phase 1B. So how are they going to get notified, and who should they be talking to about getting appointments if you have these two or more conditions that make you eligible under phase 1B?
Yeah, this is one of the areas that we're still working through as we're working with the state and getting direction from the state on how that's going to work. I unfortunately don't have a definitive answer for people for that today, but they will need to have a letter certified by their physician that they have two or more of these medical conditions that will allow them to be able to get the vaccine. We will just have to send out more information as we get it.
Would you recommend that people talk to their doctors now to try to get that letter, or should they wait? Which would be better for people?
I think they should wait to hear from their primary care area so that they know how they're going to do that.
Okay. And again, who is going to be contacted by Cheshire Medical, and who can just go ahead and sign up for their vaccine appointment?
I would say anybody in the 65 or older can sign up as soon as it opens on 1/22 and wait for some further direction as we get it from the state, as it's still pretty fluid for those other populations to make sure.
Okay, great. And so we're going to be heading into phase 1B next Friday again. Do you anticipate the process changing as we go through the phases? 2A is going to be the teachers, and then 2B, 3A, 3B. Do you anticipate the process changing as we go through these different stages for how to get appointments and that kind of thing?
Well, I'm sure with anything as we're moving forward and learning the process that things will evolve and improve, or they may find better ways to reach everybody. So I would say that it would probably remain pretty fluid as we move through the phases.
Great. I'm going to just, one more question actually that I want to make sure. Do you anticipate the Criff Road site being kind of a drive-through, or how is that going to be handled? And are people going to have to wait 15 minutes to see if there's any reaction to the vaccine?
It's a drive-through site as it right now. They do wait for a period of time. Currently with the 1A folks, that is something that I would have to defer to the Public Health Network as we move forward, as they're coordinating many aspects of that, working with the National Guard.
Great, thank you. I'm going to turn this over to my colleague, Olivia.
Okay, so the next round of questions are going to be for you, Alok. So I'm sorry for all of them in advance. So first off, one of the biggest questions that we've been asked is, what does the vaccine actually do for you? So some people are wondering, does it prevent you from getting COVID, or does it just reduce your symptoms, or does it help you from transmitting it to others? So can you talk a little bit about what the actual logistics of it are?
Sure. So, firstly, both these vaccines, which have currently been approved for use in the US, the Pfizer and the Moderna, both are mRNA vaccines. Both work in a very similar fashion. The technology is not entirely new. This is something which has been worked on for more than a decade. It's just that they've tried to use this with other vaccines, including influenza, Zika, but those vaccines, for whatever reason, didn't show as robust a response as we saw with COVID-19. And that is one of the reasons why we had this technology ready, and so we could go live sooner rather than later. So at no point have we compromised in any way in the production of these vaccines or utilizing this product. I think once someone gets this shot, obviously all of these are valid questions. So, how does it benefit the person receiving the vaccine? So when you look at the data, it definitely showed that post the second dose. So for the Pfizer, the way they talked about immunity is 7 days post the second dose. For the Moderna vaccine, it was 14 days post the second dose. And they saw that both these vaccines had efficacy anywhere between 94 to 95% in preventing symptomatic COVID-19 disease. So when they looked at the placebo group, one who didn't get the vaccine, and then one who got the vaccine, and in between these two cases, beyond those time periods post the second dose, who had that symptoms consistent with COVID-19, those who were tested and were positive, the difference in that was 95%. Now, one of the points which is being talked about is, okay, so what we know about COVID-19 is a significant portion of this illness, almost 35 to 40%, depending upon the data you see, talks about asymptomatic infection. And can it prevent asymptomatic infection as well? That has not really been studied in any of these trials. But what's important to understand is it is very difficult to believe that a vaccine which prevents symptomatic illness will not prevent asymptomatic illness either. So there is an element of extrapolation that we may have to use as we further move on with using this vaccine. I think however, until that part is known in a confirmatory fashion through data, that is one of the reasons why we are still saying, okay, even if you get the vaccine and even if you're considered immune, basic conservative measures do not change. So be it universal masking, be it physical distancing, be it consistent washing of hands, avoiding gatherings, that all is not going to change, at least at this point with whatever we know. I think the important piece to understand is we're hoping it reduces asymptomatic illness as well, but we're not entirely sure about that. But a key portion that they did analyze in the trial, apart from looking at reduction in symptomatic disease, is both these vaccines definitely reduced the severity of illness. So severe COVID-19 leading up to intubation, hospitalization, vaccine definitely benefited those who actually received the product. So I think multifocal, multimodal advantages, both personal and sort of from a community standpoint. So all that should be taken into consideration. And obviously the data is evolving. So once we know more about asymptomatic illness as well, I think that will definitely be another feather in the vaccines cap.
And how long will the vaccine last, or do we not know that yet?
So we don't really know that for sure. Whether this is going to be a yearly affair, is this going to be something similar to the flu vaccine? Coronaviruses historically have gone through mutations significant enough to affect someone's immunity. That usually happens once every 2 or 3 years. So is that what we're going to expect? We really don't know. I think some of the preliminary phase 1 trials with each of these products, people had enough neutralizing antibody titers in their blood even 3 to 4 months out since they received the product. So we at least hope that it would be there for 6 months to a year. But both these companies are actively looking at that. They are looking at the volunteers because Moderna, for example, started their initial trials last March. So we're almost coming upon a year at this point. So they are getting in touch with those volunteers again. Their studies might involve serological analysis, looking for antibody titers. Do we need boosters? Do we not? So a lot of that is fluid. But I think in the current phase, when we don't know much, we definitely know that in the short range it helps. And I think that is going to be key if we really want to get this pandemic under control.
Sure. And what happens if you don't get the second dose of the vaccine, or if you get the second dose after that recommended time frame?
So the first part of that question, what happens if we don't get the second dose? And that can happen, right? So if you have an anaphylactic reaction to the first dose, or for whatever reason, someone decides to skip the second dose, we really don't know what sort of an immune response are they going to mount. When the data looked at certain individuals who got one dose, again, we have to take that into consideration, knowing that N was really small. So extrapolating that information to a larger population is difficult. But between dose 1 and dose 2, the vaccine efficacy was somewhere between 50 to 55%. So it did offer some immunity, but again, the first dose is a priming dose, the second dose is a booster dose. So what happens in someone who doesn't get the second dose? Will their immunity wane sooner than someone else? We really don't know, which is why the studies were done with 2 doses, and that's what's recommended. Second part of your question, what if someone gets it beyond the time interval? So the way the CDC is recommending it right now is at least 21 days between the 2 Pfizer doses and at least 28 days between the 2 Moderna doses. There is a 4-day grace period allowed for each of these products, which is to be used as an exception, not as a norm. So we want to try and stick to the interval as much as possible. But there is no reason to believe that slight bit of an extension beyond these regimens, so say someone gets it on day 25 for Pfizer or day 32 for Moderna, there is no real data to say that, oh, that's not allowed and you're going to now have to repeat the series. That's not recommended. Because the hope is you have enough of a priming response with the first dose that a slight bit of an extension or a leeway with the second dose is allowed, and you should still develop a similar response that you would otherwise.
And how do you schedule the second dose? This might be a Ryan question, but a lot of people have been asking, do you schedule it during your first shots appointment, or do you have to go back onto the website? How does that work?
I think that there's some more information that needs to come out with that. Usually, currently with the first, the 1A people in the public sites is once you've had your first dose, then you'll be eligible to sign up for your second dose once they know what vaccine you have and how far out they need to schedule that depending on when they have clinics as well.
Yeah, what we did for employees internally when we went through phase 1A, and kudos to Ryan and her team for taking upon that big task. So you get a small card which sort of is CDC printed, which talks about the batch number that you got, the date that you got your first vaccine, and the product that you received. And what we were doing is, since this was more of an internal approach, we scheduled the employees for the second dose when they came for their first dose itself. And that was written on their card, and they got these small appointment cards serving as a reminder to come back. So again, I think with the larger process in play, it is going to be key to understand that patience is important. A lot of this is fluid. A lot of us are sort of doing, in the US, mass vaccination in itself is a very new thing. We've really not undertaken anything to this effect this fast. And hence, there are going to be kinks which will have to be worked out as the process goes on. But we just want everyone to be patient and cooperative so that the eventual aim is to get everyone who's interested vaccinated in the right amount of time. But there will be some bumps along the way, but we'll iron them out.
Sure. And I think that the other side of this conversation that most people are worried about is, what is the effect it's going to have on someone? Are you going to have some adverse side effects? How is that, going to shape up for you? So can you start by just talking about what's actually in the vaccine and if both of the doses have the same ingredients?
So primarily both are mRNA vaccines. So the main product is mRNA. Again, it's not the exact same product. They both are patented differently. But in general, the compound is the same. What's important to understand is mRNA in itself, as I like to call it, it's a melty structure, meaning it's unstable when it's exposed to heat. So when they had to manufacture these vaccines, they had to coat the mRNA in a lipid molecule. That lipid molecule is made out of polyethylene glycol, which is PEG. And that has most of the reactions that we are seeing. And again, these are not over and above what you would see with some other vaccines. But most of these reactions are being driven by this polyethylene glycol component. Both these vaccines use PEG. That has some degree of cross-reactivity with another compound called polysorbate. Moving on, if you look at the individual components, both of them have salts. So the Pfizer vaccine has sodium and potassium salts. The Moderna vaccine has something known as tromethamine. And then if you go on further, both of them have cholesterol and certain other ingredients as well. And I would really urge everyone in the public to go on to the CDC website, because a key portion of this entire process has been transparency. And CDC's made all this available for public viewing down to the T, including every component used in these vaccines. If you look at the adverse reactions, again, what we have to think of is both these vaccines are labeled as what is known as reactogenic. So a comparison, if I had to make one, would be with the shingles vaccine. And in public who's not experienced that vaccine, I think you would like to think of as the tetanus vaccine that you would get. So there are two components. One is a local injection site reaction, which would include pain, swelling, redness, and some warmth, which lasts no longer than 24 to 48 hours. I think most of what our experience has seen, and even personally, it lasted for probably 12 to 16 at the most. The second set of side effects that you would look at is systemic. So commonest ones seen in the trial, commonest ones which we've seen amongst our employees, would include chills, fatigue, headache, myalgia, so muscle aches, and some complaint of joint aches. Fever was seen in about, at least with the Pfizer products, in about 4 to 5% of the individuals after dose 1, and about 15 to 17% after dose 2. Again, nothing that is not expected. This clearly shows that your immune system is functioning. The effects are higher after dose 2 because that's a booster phenomenon. The first one was a priming phenomenon. And interestingly, when you look at the data, the older individuals who received the vaccine had lesser side effects compared to the younger population. So that is something to keep in mind as well. Common question I'm asked is, if I don't get any side effects, does that mean my immune system didn't work and the vaccine's a waste? I would say no. Each individual reacts differently, and that is why we have percentages. It's not like 100% complained of side effects, and everyone's tolerance is different. But none of these symptoms should last more than 24 to 48 hours, because if they do, then, as I said before, they're not 100%. So there's still a chance you may have acquired COVID either before or in between your 2 doses of the vaccine. So any symptoms that linger longer than 48 hours or symptoms that are not consistent with the vaccine. So for example, the vaccine will not give you COVID-19. So the vaccine should not give you cough, should not give you shortness of breath, should not give you nausea, vomiting, or diarrhea. So if you have these symptoms, then you might as well get tested. If you have headaches, chills, myalgias, wait it out. It is okay to take Tylenol, ibuprofen, any other non-steroidal anti-inflammatory drugs. There's a common misconception that this may blunt my immune response. The vaccine may be rendered waste. That's not the case. We do advise don't pre-medicate yourself, but don't wait too long because then the symptoms get bothersome. And then someone's like, well, I'm just going to skip my second dose. We really don't want that. So there's a key timing, but it's okay to take these meds.
And are there any ingredients in the vaccine that people could be allergic to?
So polyethylene glycol is what is thought to be potentially driving some of the severe reactions that we are seeing. But interestingly, when you look at the data, polyethylene glycol is used as a component in several other drugs and food products. And severe adverse events or any severe allergic reactions amounting to anaphylaxis has at baseline been a pretty rare event with these things. The CDC published a report in Morbidity and Mortality Weekly Report last week that even with the vaccines, when they've actively tracked data from all over the country, the rates of anaphylaxis, even with this vaccine, which could be potentially attributable to the PEG component, has been about 1 in 100,000 people. It's still higher than what we would see with some of the other vaccines. But to put things in context, penicillin-related anaphylaxis can be 1 in 5,000. So when you take antibiotics freely, I think 1 in 100,000 chance of anaphylaxis, that too which could be or could not be attributed to the vaccine, I think it's a fair chance.
And as you probably know, there are a lot of rumors circulating about some of the side effects that may be caused by the vaccine. One that I've heard quite often is that the vaccine can cause infertility. Can you talk about that and if that's true?
So none of the data trials showed that. Interestingly, if you look at the Pfizer trials in detail, there were actually women who became pregnant in between or found that they were pregnant in between dose 1, dose 2, and even after dose 2. They were excluded from the trial eventually. There is really no proven evidence to show that this affects either male or female fertility per se. And I think it is one of those things that comes along when a vaccine's launched, that there will be certain rumors, but this is a myth at this point.
And can someone who is pregnant or breastfeeding get the vaccine?
So both these populations were really not included in the actual trials because obviously these trials had to recruit at a fast pace and come out with data. So had they gone into the nitty-gritties to really include immunocompromised hosts, pregnant lactating women, it just makes the trial more complicated and wouldn't have been able to come out with the data as fast as they did. But what's interesting to know is, again, it's not a live vaccine. So it should not have contraindications or have adverse effects on the child, either one which is not born yet or even post-birth through breastfeeding. So the ACOG, which is the American College of Obstetricians and Gynecologists and Society of Maternal Fetal Medicine, has gone on to endorse that as long as women are given the option of having a conversation with their providers, they have endorsed getting these vaccines. Because what we know for sure is if pregnant women get afflicted with COVID-19, severity of illness is definitely higher. And there is a chance that potential child outcomes on the unborn child are grave. So when we know that, it's a risk-benefit conversation saying, okay, would you rather suffer from COVID-19 or would you get a vaccine which, at least based on the conceptual evidence that we have, should not have adverse events, on you? And we've had a lot of pregnant women, call us and talk to us about it. But even nationally, a lot of healthcare workers who are pregnant and or breastfeeding have gone on to say that they have gotten the vaccine and they've done okay so far.
Great. Well, I'm going to pass it back over to Cecily for another round of questions for you.
Thank you. Speaking of sort of a risk benefit analysis, we have this question from a reader. And the reader says, I realize some say the risk of getting COVID outweighs the risk of possible long-term side effects that are unknown at this point, I'm guessing regarding the vaccine. But if the chances of dying from COVID are less than half of 1%, am I really better off getting a vaccine that we don't know the long-term effects of?
So you can look at it from at least 2 points, right? So historically, what we know of vaccines that have been approved and have been used, we really don't have hardcore evidence saying that the long-term side effects are such that we've gone on and pulled these vaccines out of market. So I think even though in the current time, we do not know the long-term side effects associated with this vaccine, the likelihood that they are present in such a number that should contraindicate administration, I really don't think so. We're not seeing that signal. And historically, what we've known about vaccines, it would be hard for me to believe that that would happen with this particular product. I think, and I've heard a lot of people say this is, okay, the mortality rates aren't that bad, especially in certain age groups. So why should I really worry? What I would like to highlight is a very common thing that we're now seeing with COVID is these long-term complications of having had COVID-19. So we've had athletes who've had reduced exercise capacities because of inflammation of their heart muscles known as myocarditis. We've had lung damage, which is lasting, known as pneumonitis. So all of these things can tend to people feeling unwell, people feeling fatigued, people feeling restricted from a respiratory or a cardiac standpoint, even months or potentially almost now a year out from when they were first diagnosed. So even though we know that, okay, the mortality rates may not be that high as you may see with something else, I think what we shouldn't discount, especially in the current times, is what are the long-term sequelae of this illness and how is this going to affect us? And once you take that into perspective, I think it's easy to understand that vaccines probably better.
Thank you. And another question we had is about the speed at which this vaccine came to now the public, being dispersed to the public. Can you tell us what steps during the development and eventual approval process were kind of faster than would normally be happening with a vaccine? And does that affect the safety at all?
So I think I would say right off the bat that they have not compromised on any of these safeguards. So, we are not worried about the safety of this vaccine. I think it's completely safe, and those who are interested should get it. I think one of the reasons why we saw this coming into the market so fast is the technology, as I said before, wasn't entirely new. mRNA vaccines, these are the first mRNA vaccines to get approved, but mRNA used as a technology to manufacture vaccines has been experimented with for more than a decade now. We've tried it with Zika, we've tried it with influenza, and some of the reasons why these didn't come into being is because either the response wasn't robust enough, or people were still trying to understand what these mRNA vaccines can do and how do you prevent the mRNA from being disintegrated? Because as I said before, it's an extremely melty structure. And then someone came up with this idea of coating it in a lipid molecule. Now, the downside to that is logistically, this became a difficult issue because they all need temperatures which are minus 30, minus 60, minus 80 Celsius. And that complicates the life that they can be in a refrigerated state, so on and so forth. But I think when you look at that, the other thing that they did was these were one of the first vaccine approaches where production and trials moved simultaneously. What's the risk we ran with that approach is if the trials failed, you lost a lot of money producing a vaccine which really was ineffective. But the advantage is what paid off for us is November, they came out with data saying that these vaccines are beneficial. And you already had built a repository of enough product that within 24 hours of approval, they could start shipping these out to the state. I think from a vaccine regulatory perspective, they went through all the appropriate steps. So they designed trials which were approved by ethics boards. We had the companies sort of get independent data safety monitoring approvals, look at this data. It was then presented to what is known as Vaccine Regulatory Board Advisory Committee, so VRB PAC, which is a conjoint venture between FDA and the Advisory Commission on Immunization Practices, so ACIP. And usually this takes years, right? So they'll analyze the data, then they'll talk about it, then there's a back and forth. But all of these agencies and regulatory bodies were committed to getting these out in the right amount of time, because delaying this by 2 years when the pandemics hit us so badly didn't make sense. So ACIP and FDA and VRB PAC sat down together through the nights and within 24 hours have come out with these approaches. But again, if you look at these panels, they're built with experts who have done this for so long and have analyzed this data and teased it down really carefully. And I think something that we in the infectious disease world were worried about is, are they going to be transparent about this? Because this was important. And I think they did that, because all of these meetings have been recorded and put on YouTube for public viewing. People had the opportunity to log into these live and look at the proceedings in actuality. And within 24 hours of the meetings, the entire data was published on FDA sites and was downloadable. So anyone who wanted to see it, tease it down, ask questions, had the opportunity to do that. And I think that really went a long way in getting the physician and the provider community to believe in this product so that we can advocate the same to our patients.
And another question for our reader has to do with the school system. And here in the Keene School District, our students have either been hybrid or remote for the 2021 school year. Once teachers and staff in schools receive vaccines, would you recommend the leaders in our school district evaluate the plan and move to on-site learning?
I think that's a fair question. And something that I would like to allude to is, even between, so April, May was sort of when we saw our first surge in New Hampshire. And again, compared to some other states, that wasn't a major surge in itself. And then the second one we've sort of seen in November, December, along with the holidays. In that in-between time, it's really commendable the job that school districts and even, for example, our local site, Keene State College, the job that they have done is amazing. Everyone was worried with everyone moving towards in-person learning, is that, oh my God, we're going to have major outbreaks and we're going to have a tough time controlling this. But if you look at the numbers, they really didn't contribute much to the case numbers or to outbreaks. So I think, whatever the schools and colleges did, be it testing, be it guidelines, be it, conservative interventions within their setting, worked. And I think that's something to take into consideration as well, is as long as we continue doing that, plus now you add the tool of, okay, once the staff is immunized, you partly have some of these drivers of potential drivers of infection now immunized, and can they move back? I think that's a fair choice. We really don't want to continue with a remote or hybrid model, because that's going to affect the kids in a different way, which again, repercussions of which we will not know until later. And I think, once you have certain safeguards in place, it has to be a phased option, but can definitely be considered and taken into as an opinion and move towards in-person learning.
We are starting to get to the end of our session. We only have 5 minutes left. There have been a lot of questions about people's specific medical conditions. Is there anything that we can direct people to? I'm afraid we won't be able to get to all of these specific questions. Is there something that we can direct people to if they have specific questions about whether their medical conditions, A, will either allow them to get the vaccine, or B, when they'll be able to get the vaccine, which phase?
So I think as regards the phase, again, New Hampshire Department of Health and Human Services has been pretty transparent and has their entire vaccination draft plan and the phases available for public viewing on their websites. I think pertaining to some of their personal medical conditions, be it immunocompromising conditions, be it the fact that they may be on certain medications. I think so. Cheshire Medical Center, our approach here has been that on our website, we've had this sort of a section which we've devoted to vaccines, which our marketing communications team in consultation with ID and infection prevention have made an effort to try and keep it updated so that people have the right sources that they can go to for this kind of information. So some of the links include our own FAQ page, the Dartmouth Systems FAQ page, and we have provided links to both the CDC and New Hampshire DHHS FAQ page as well, which I think have done a fabulous job in addressing some of these very common questions, yet pertinent. And I think after exhausting all these sources, if people continue to still have questions, reaching out to your provider, and I would say calls can get busy, calls can get frustrating, there are wait times. But say, for example, if someone's a patient of Cheshire Medical Center and you have access to the portal, send a message through that, and folks would be more than happy to answer you.
And just to reiterate some of the information from the beginning, again, next Friday, January 22nd, phase 1B will open for vaccinations in the Monadnock region. The vaccination will take place on Criff Road in Keene. And Ryan, do you know what time that's actually going to open on the 22nd? Someone is asking, would it be, midnight? Will it be another time? Do you have that information yet on exactly when that's going to open?
I don't. I only have that it starts on the 22nd.
Okay. We'll see when it gets closer if we're able to give people an exact time, because we know there's people who are wanting to do that right away. And see if there's anything else we can tell people. Go to vaccine.nh.gov. That's the place where you're going to be signing up for your appointment. Let's see, anything else that we can tell people?
I think one thing I would say is, so the hospitals with the marketing and communications team and the public health, the Greater Monadnock Public Health Region authorities, there will be adequate, ample messaging going out once we have the protocol crystallized. Folks need not worry. They will not be in an abyss where they're really not hearing anything. And we're not going to say, okay, these are Cheshire patients, so we're only going to reach out to them, and these are not our patients. So, the messaging is going to be loud and clear. It will be publicized through our website. We will make every attempt to partner with local print and digital media platforms to sort of get the message out there. But I think, again, the key is going to be patience. So because we want to do it right. And so you don't want back and forth saying, oh, I said that and can't really do that. Okay, so we're going to backtrack now. So it's going to take a little bit of time, but there will be enough messaging going out so that everyone understands the process appropriately and that we get everyone vaccinated.
Yeah, we at Cheshire plan to work with the community and be a community partner in getting everybody that wants to be vaccinated. Thank
you. And just one more note, if you are in phase 1B and you are either 65 or older, or you have those two different kinds of conditions, you need a note from your doctor in the case of the conditions before you go to your appointment. And if you're 65 and older, you just need some ID proving that you are 65 and older. Okay, great. Well, thank you so much to Ryan Hornblower and Dr. Cole for participating in this with us. We're sorry we could not get to all of your specific questions, but we hope this has helped you. And please feel free to reach out to us here at the Sentinel, or go on to some of the websites that Cheshire Medical has posted in our chat to try to get more information. And again, thank you so much for joining us.
you for having us.